Minister, my question follows on from that of Baroness Walmsley about the scale of the trial, noting also the report from the experts at the Council of Europe that the Noble Lady referenced. Now, in the other place, the Secretary of State said the clinical trial will be uncapped, responding to my honourable friend Carla Denyer, and the Noble Lady, the Minister, has repeated that phrase uncapped this evening. But yesterday, published in Metro, was an article arising from various Freedom of Information requests, headline, "Trans Youth Languishing While Waiting 6 Years for Healthcare." So if a trans young person joined the waiting list for gender-affirming healthcare on the NHS today, they'd have to wait 308 weeks for a first appointment. So I guess in that context, I'm struggling to understand where the government is going to secure the resources from to run a trial to provide the resources that are needed so we can have this uncapped clinical trial allowing access to puberty blockers.
It might be helpful if I say to your Lordship's House that currently the size of the Children and Young People's Gender Services waiting list, I think it's quite important to consider that in view of what the Noble Lady said, is currently 6,237 people are on that list. I certainly agree that waiting lists for these services are too long. We are committed to changing that, which is the reason I outlined the timetable for the new gender services and the opening of the new centres. They will increase clinical capacity and reduce waiting times for sure. There is a commitment to the clinical trial, to the point the Noble Lady raised, and I'm glad there is, because we have brought forward this legislation in an absence of evidence. I believe it's incumbent on us as a government to follow through what the previous government started in train, which is to use a clinical trial to provide the evidence. Otherwise, the debate remains uninformed and unevidence-based, and that cannot be helpful.
Lords,